Little is known about whether salvia causes any long-term damage to the brain, or even whether it's addictive. But one thing researchers do know is that magic mint may well hold the key to important new medical advances.
You can basically sample all the amino acid space in an unbiased fashion.
Professor Brian Roth is a psychiatrist and pharmacologist at the University of North Carolina, and his lab is one of hundreds investigating salvia's potential.
What did you find?
6 plates.
You've got 6 plates?
Yes.
Really? Of what?
Professor Roth is credited with discovering the unique impact of the herb's active compound, salvinorin A. He says that while other drugs typically stimulate many receptors in the brain, salvia is unique in that it stimulates just one.
That's the receptor molecule, and this is salvinorin A, this red and white thing here. You can see it there?
Yep.
See it? And that's how it binds to the kappa opioid receptor. So in blue here, this is the receptor.
That highly unusual quality could inspire unprecedented breakthroughs, with early evidence suggesting new possibilities for the treatment of pain and psychiatric problems.
And so here you have a molecule that Mother Nature has made, which is highly selective for one target. And if we can understand why that is, then that might give us some clues into how we can use that information to make basically more targeted medications for a number of other diseases.
What's more, salvia may even hold the key to new treatment for drug addiction.
Which in some ways is somewhat paradoxical, because here you have this hallucinogenic agent, but paradoxically it may actually have the property of diminishing the reinforcing or drug addictive properties of certain drugs like cocaine, heroin, and so on.
But some are deeply worried about salvia's increasing popularity.
So I've asked our staff here in North Carolina to do research for me, to propose some legislation that would deal with that as an illegal substance in North Carolina.
Republican Senator Richard Stevens' immediate reaction to seeing the YouTube videos was to propose his state impose a ban.
And there were hundreds and hundreds of examples of young people showing themselves in the video supposedly having used this drug. There was one I watched that showed a controlled environment in which a person was there not using the drug, and someone who was, and then the person was describing what they were feeling and their reactions. And they were very violent and very, very strong reactions in every case.
It's salvia.
Come on, get me off this.
It'll go away in like 2 minutes. Just give it. Just let it go.
13 US states have already banned or regulated salvia's use. And America's Drug Enforcement Agency is now considering whether to place a nationwide ban on salvia.
DEA is currently in the process of looking at salvia to see whether it should be controlled federally, under and according to the provision of the Controlled Substances Act.
But outlawing the herb could have unintended consequences. Professor Roth says scheduling it as a Class 1 drug in the same category as heroin and cocaine would stifle the promising research currently taking place in hundreds of labs.
It's possible that a hysteria could develop based in part on all of these videos on YouTube, and lead basically to this immediate scheduling of Schedule 1. And then if the compound is Schedule 1, it's nearly impossible to then use it, to develop that compound as a therapeutic agent. So it basically puts the kibosh on all sort of therapeutic drug development.
If that many young people are using this drug with that kind of reaction, it ought to be dealt with. Our young people, sadly, in this country using lots of different kinds of medications for a thrill, for a high, and get themselves hurt, get other people hurt, cause great kinds of calamities in their own families. It's an issue that needs attention.
But surprisingly for once, not every politician is keen to open up a new front on the war on drugs. Democrat Senator Ellie Kinnaird is co-chair of North Carolina's Justice Committee.
I think we have to go very carefully, and we have to say, is this really a menace? Is this really something that is spreading rapidly and is causing a great deal of trouble for young children or young adults, whatever? Or is this something that is probably very limited in scope and probably, from what I've read, not the most fun and therefore will not continue?
Sit down, Joe. Chill out.
Stop him with the camera. Stop. Stop.
You're in my room.
Oh, God, I'm tripping.
I couldn't get up and just want to do some salvia in the morning and trip face. You know, that's a little far-fetched.
Would you do it again?
No, pretty much just personally I'm studying psychology, and all those psychotic symptoms scare me, so I don't want to experience that anymore now that I'm that much more aware of what all is going on. I'm not interested in it.